Good morning, folks, and thanks for being here to discuss the important role that face masks play in keeping our communities safe from COVID-19. My name is Louis St. George, and I'm the Media Relations Specialist at Essentia Health. We'll start today with Dr. John Pryor, President of Essentia's East Market. And Dr. Pryor will be followed by Dr. Andrew Thompson, Infectious Disease Physician at St. Luke's, Amy Westbrook, St. Louis County Public Health Division Director, and Duluth City Councilors Eric Forsman and Therese Tomanik. To ask questions once they are done speaking, you can use the raise your hand function and wait to be called on, or you can submit them in the Q&A feature at the bottom of your screen. Please specify to whom your question is directed. And we'll aim to wrap things up today, probably around 11:45 or so. And with that, Dr. Pryor.
Thank you. Hello, everyone, and thanks for joining us today. I'm Dr. John Pryor, President of the Essentia Health East Market. It's been a while since we met like this. Mid-May, I believe, was our last virtual get-together to discuss COVID-19. I think I had shorter hair back then. I know I did. Besides my hair, much has changed since that time. But one thing that has not changed is the effectiveness of wearing face masks to reduce the transmission of this virus. It's kind of funny, isn't it, how something so rudimentary could be so undeniably important. Evidence is irrefutable. We know that now based on recent scientific and clinical studies. Simple cloth face coverings, if worn broadly, have the potential to dramatically slow the spread of COVID-19 and save thousands of lives. There was a recent report in the Wall Street Journal that shocked me. It stated that Hong Kong, a very densely populated country, that's close to population or density to New York City, has had just 6 COVID-related deaths. Compare that to New York City's almost 20,000 deaths. One reason given for the disparity, Hong Kong has a 97% mask compliance rate during the mid-morning rush hour when people are close together. Statistically speaking, it's a no-brainer. Consider the following. The University of Washington's Institute for Health Metrics and Evaluation is forecasting more than 179,000 COVID deaths in the United States by October 1st. However, if 95% of people wear masks in public, that number drops to 146,000. That means we're saving more than 30,000 lives. That same group at the University of Washington says that 95% mask compliance in the United States could result in a 50% decline in transmission. The scientific journal Mathematical Biosciences, which I'm sure we all subscribe to, goes even further, predicting that a high use of face masks in public could eradicate COVID-19. That's because, as Dr. Amanda Noska, one of our infectious disease physicians here at Essentia says, if you don't give the virus a way to transmit itself to another human being, it will die. The Minnesota Department of Health reports that almost 8,000 cases statewide have no known source of infection. That's because close to half to everyone with COVID-19 is asymptomatic. They have it, but don't know it, which underscores the importance of wearing a mask, especially when you're in public and in close proximity to others, because you don't know who has or does not have COVID-19. I'll stop there, but we could spend much of our day reviewing studies and scientific evidence. Masks make a difference. They have been proven to protect us. By wearing a mask, you are not making a political statement. You're making a statement that says, I care about others, because that's really what masks do. They protect the people around you. And if we all do our part by wearing masks, by practicing social distancing whenever possible, by washing our hands, we can drastically lessen the threat of COVID-19 until a vaccine is available. That's still months away, a vaccine being available, and it's a really sobering thought. But this public health crisis isn't close to being over. We're in it for the long haul, so we must remain diligent and take these precautionary steps, like wearing masks. This issue should not divide us. It should unite us in a common cause to protect each other. One final thought before I turn this over to Dr. Thompson, and I hope he talks about, we don't know what each other's talking about. I hope he's talking about the same thing, and there could be overlap, and that's important for you to hear from 2 independent physicians just how important this mask issue is. But I would just ask that everybody be smart over this holiday weekend. This is no time to get lax. So enjoy it, have fun, but please, if possible, limit the number of people you're around, wear a mask, especially if indoors, and of course, wash your hands. Happy 4th of July, everyone. Dr. Thompson?
Thanks, Dr. Pryor. I really couldn't agree more. I recently got a haircut. My wife cut my hair, and I think she did an outstanding job. But regarding COVID-19, I'd like to recognize that I'm really weary. I'm tired of it. And I think we're all really weary of COVID and all of the changes that we've had to make. It's been a long 4 months, and we've made significant sacrifice during that time. And it's hard to see any end in sight. We know that this will have to go on for months and maybe years. But the virus doesn't care. The virus doesn't care that you've missed visits with grandchildren, birthday parties, meeting at bars, hugging a friend, carefree shopping. The virus has one mission, which is to reproduce and infect new susceptible individuals. So we're awaiting advances in treatment and vaccines, and I think there are some signs of hope, some cause for optimism there, but it will take time. So there are some very important things that we can all do right now to make a huge impact against this virus. Dr. Pryor is correct in that if we all wear masks and maintain distance, we could shut this virus down. We could eliminate it. But the degree to which we'd have to do that is very high and very, very difficult to achieve. So there are 3 important things that we can all do to limit the spread of COVID-19. First of all, it's to maintain that social distance. We know that the vast majority of disease is spread by respiratory droplets. And if you can stay far enough away from other people, at least 6 feet, it's unlikely that you will catch COVID. That's not always possible. And so the next most important thing is to wear a mask whenever you're around other people. Additionally, wash your hands, because we know that is also a likely means of transmission, though probably less so than the respiratory droplet transmission. So whether you're at work, at the store, at an appointment, wearing a mask is crucial when you're out of the house. Everyone plays a role in slowing the spread of COVID-19 and protecting themselves, but as important, and maybe more important, protecting your family, your community, and those that are vulnerable in our community. I think it's too easy to forget that people think about a mask as protecting themselves, but my mask protects you. A significant number of people infected with COVID-19, maybe half, will have no symptoms or very minimal symptoms, or they might not develop symptoms for a few days, but they're still contagious. In that period, wearing a mask is critical because it prevents those germs, those viruses, from traveling through the air and onto others when you speak, when you cough, when you sneeze, or when you sing or shout. Wearing a mask is uncomfortable, and I think we need to recognize that. It's what I consider kind of a nuisance. People can't see my mouth. People who are hard of hearing maybe have a harder time understanding me. It's uncomfortable, but it's a nuisance, and it has significant benefit. You don't see the benefit right away. You don't see that you're preventing someone else from getting sick, from landing in the hospital, and potentially from dying. So I think we have to recognize the cost here is low and the benefit is huge for everyone to wear a mask. We want to stay open. Businesses want to stay open. Hospitals want to stay open. We want to be able to provide the care, the routine care, as well as the acute care as far as surgeries and clinic visits and things like that. We want to be able to keep doing that. And it's critical that we keep a low prevalence of disease in our community, and everyone needs to work to do that together. It's important to wear the mask correctly when you do it. Try to limit touching it as much as possible. Wash your hands before you put it on and after you take it off. And if you're wearing a cloth mask, like many are, it is important to wash it daily if you can. I think I've hit on all the important points that I wanted to make today. Don't forget about distancing. A mask doesn't replace social distancing. And as we're coming up on a holiday weekend when we're accustomed to gathering with other people, really remember to keep your distance, wear a mask when you're around others, and wash your hands. Thanks for your time, everyone. I'll turn it over to Amy Westbrook, and happy to answer questions later.
Thank you, Dr. Thompson and Dr. Pryor. I have a lot of similar messages for, as Dr. Pryor and Dr. Thompson. We all agree in the continuum of healthcare about face coverings, and we didn't know early on the value of them this spring. We're learning more and more about this virus, but face coverings are a very effective way for prevention and control of coronavirus. So I wanted to first thank people for following the governor's stay-at-home orders. We did a lot of changing community norms this spring. We did a lot of staying at home. Like Dr. Thompson mentioned, we missed a lot of important events in people's lives. We did that all so we could better prepare ourselves as a community. So our healthcare systems could be better prepared for a higher patient influx. Our businesses could be better prepared at being productive in the face of COVID. So we did a lot of really good prevention and control as a community, and we saw our numbers drop. We have seen a decline through the May and into early June, and the last couple of weeks we have seen our numbers increase over the last 2 weeks, and it looks like we may have continue to increase this week. So we're sort of sliding back a little bit, and I think we can recognize, we all know what we need to do as a community. We did it in the spring. It's a matter of changing community norms, and that's a really hard thing to do. But this is a pandemic. It's not going away. We know that it's going to be here, and there is no vaccine. A vaccine is not coming for at least multiple months, probably more. So what we have is each other. We have our own health behaviors. We have each other to rely on to really change community norms and make it the norm. It is uncomfortable going to someplace where you typically do go and see people shopping and you're wearing a face mask. It just isn't what we know, but it is really important. And it's really about changing community norms. We all want our children to go back to school in the fall in person. We all want the college students to come back. We all want tourism to come back. We all want businesses to be productive. And in order to maintain that, as we're turning up these dials of opening up our communities and societies, we are really asking people to do their part. And that is a big part. We don't have a vaccine. The pandemic is really here to stay until it really runs its course. It's a virus that very, very few of us have ever seen. And if we have seen it, it's just been within the last few months. So it's really important. We're the ones who are deciding as a community how much we can flatten this curve. So as Dr. Thompson and Dr. Pryor mentioned, face coverings are a huge part in doing what we can in changing our health behaviors to prevent and control the spread of COVID-19. And coupling that with hand washing, physical distancing, and staying home when you're sick. We know that we do see symptomatic and asymptomatic people test positive for COVID-19. So we know that asymptomatic people are able to spread the virus. We are in St. Louis County, the age cohort that has the highest number of cases is the 20 to 29-year-olds. It's slightly different than the rest of the state. So we want to reinforce that all ages, this is important for all ages. Just within the last 2 days, over half of our cases have been 20-something-year-olds. And so we want to make sure that everybody is receiving this message, that everybody has a part to play regardless of your age. And then I also wanted to just reinforce that this applies to all urban and rural settings. Our rural settings, it's tempting for people in rural settings to be less cautious. There's less density. People may feel a little bit more secure, but it's still, our rural settings are also a bit older, a bit farther from healthcare systems. So it's important for people living in urban and rural settings to really follow these precautions. So I think that's about what I wanted to say. So I'll hand it over to Councillor Forsman, I believe.
Yes, good morning, everyone. My name is Eric Forsman, and it's my honor to serve as a city councilor here in Duluth. Joining me today on the call is Duluth's newest city councilor, Teresa Tomanek. First, I just wanted to say thank you to both of the teams at Essentia and St. Luke's for having us. We are blessed to have both of our health systems leading in this time of COVID-19 and are honored to be here with you. And thank you in particular to the nurses, doctors, and all of the direct care staff and essential workers who are truly Duluth heroes. We've heard a lot this morning from Dr. Pryor, from Dr. Thompson, as well as Amy, about why wearing a mask or a face covering is the right thing to do for ourselves, our loved ones, and our neighbors. It's also the right thing to do for our economy. As we watch the devastating toll that COVID-19 is taking in southern states who are in their indoor season, we stand here at a crossroads. We can choose to roll the dice and risk the potential for surging cases and turning the dials back down on our economy once again, as we're seeing in other parts of the US, or we can choose a simple, proactive action that prioritizes Duluthians, prioritizes our public health and safety, and prioritizes our local businesses. Today, Councillor Tomanek and I are announcing that members of the Duluth City Council are proposing to take immediate action. With the strong support and partnership of Mayor Larson, Councillor Tomanek, Councillor Janet Kennedy, Councillor Joel Cypress, and I will be co-sponsoring an emergency ordinance that would require the use of facial coverings in indoor public spaces within the city of Duluth. This proposal is likely to be considered and voted on at the council's next regularly scheduled meeting on July 13th. If passed, it would go into effect immediately. As drafted, the face covering ordinance would likely last for the duration of local and state emergency declarations. More details will be available in the coming days. There are a few components of the proposal that I wanted to share with you today. The ordinance will only apply in indoor spaces where business with the public is conducted or where services with the public are rendered. This includes businesses, nonprofit entities, governments, churches, and quasi-governmental entities. There will be exemptions, including for those who are medically unable to tolerate face coverings and for children under the age of 10. There will also be exemptions for restaurant and bar patrons who are eating and drinking, areas of businesses that are not open to the public or customers, and for activities where it's not feasible to have a facial covering, such as dental offices and athletic activities. Finally, schools, childcare facilities, and fitness facilities with plans in compliance with state guidelines will not be covered by the proposed ordinance. Now, this ordinance does have teeth, and it will be enforced. Warning letters, escalating fines, and misdemeanor prosecution will be on the table for business establishments or members of the public who choose not to comply. However, let me be very, very clear that our goal is compliance. We are doing this because we want to keep our community healthy, our businesses open, and our city thriving. Now, I will admit that when I first heard of the citizen petition and this idea, I had my doubts it could be done. But the person who inspired me to think bigger and consider this opportunity to make a difference for Duluthians in this unique moment was my good friend and new colleague, Councillor Therese Tomanek. And I'd like to turn it over to Councillor Tomanek now to share additional thoughts.
Thank you for your kind words, Councillor Forsman. It's been an honor to work with you. We've heard the voices of residents and businesses in our community, and we are ready to take action. It's an honor to work with this council who has a threefold purpose in putting forth this ordinance. The first is to protect all the residents of our city and the tourists who visit us. Second, and equally important, is to protect and advance the businesses and economy of Duluth. And thirdly, we need the hope that our students can safely return to school. Councillor Forsman and I have consulted with many business owners, workers, and industry representatives to ensure that we are promoting something helpful for Duluth's economy. At least 16 states have halted or are rolling back reopening as a result of surges in the number of COVID-19 cases. We don't want that to happen here. Store owners and restaurant managers in Duluth have told us how much easier it would be to keep the shoppers and patrons who enter their establishments safe by requiring all who enter to wear a mask. The economy will benefit by people feeling more comfortable to go to their local store to shop, knowing that all employees and fellow shoppers will be wearing cloth face coverings. It's hard to buy local when you are afraid to go into a store. How great it will be to protect the grocery store checkout clerk, the post office worker selling you stamps, the clerk helping you pick out paint at the hardware store. We must also pass this resolution, this ordinance, in response to the public health crisis we are facing. One where people who are of African heritage, Indigenous, Asian, Latinx, LGBTQ+, aging, I prefer the term aging to elderly as I now find myself in that group, those people living in group homes or nursing homes who are at a significantly greater risk of morbidity and mortality. Mahatma Gandhi once said, "The true measure of any society can be found in how it treats its most vulnerable members." My friend Debbie Friedman told me she doesn't feel safe going to the places she needs to go, as her daughter has cerebral palsy, and she doesn't want to bring anything home that would make her sick. She stated, mask wearing is not a burden. It's an act of kindness. It's an act of responsibility to others. Local disability rights advocate Galen Lee states, every day that goes by without an ordinance is a refusal to regard the lives of the disabled, elderly, and people of color as equals in the eyes of the law and equally valuable as any other human being. Please do the right thing and do it quickly. Members of our community joined together at the early stages, at the early sign of the spread of the disease, and those people are the mask makers. People have donated their materials and time and talent to protect those who don't sew and don't have access to a mask. I've made some, but my friends Jan and Joe and Pat have collectively made over 2,000 masks and donated them to the hospitals, the NAACP, the schools, Safe Haven, the Steve O'Neill Apartments, and the Hills Youth and Family Services. Their generosity is greatly appreciated. We have a responsibility to all the people of Duluth to do everything we can to protect their health and indeed their lives. Requiring everyone to wear a mask in our city is a proactive, simple, and effective way to keep everyone safe and ensure the viability of our businesses. And now I would like to read excerpts from Mayor Larson's letter to Governor Walz, as unfortunately Mayor Larson is not able to join us today. She did ask that I share with this group and the public that earlier this week she sent Governor Wallace a letter formally asking him to implement a statewide mask requirement. She asked that I share a portion of this letter with you. In Duluth, we have made the intentional decision to bring this requirement forward through City Council action, utilizing decision-making authority through the legislative branch that has representation from across the city, with 5 elected councilors representing individual districts and 4 councilors representing in an at-large capacity. We feel that embedding this decision as much as possible on the local grassroots level will increase personal accountability, encourage greater compliance, and decrease dissension about its protective merits. Most cities and mayors in Minnesota will not have the luxury of this broad-based partnership and support. Statewide mobility has increased at a sharp rate. In April, our hotel-motel tax was down 87% over the previous April. In May of this year, Visit Duluth reported weekly 10% occupancy gains, and last weekend, our hotels were up to 70% occupancy. As a regional center with 35,000 daily commuters, 86,000 residents, 6.7 million tourists, and a border city to Wisconsin, we cannot wait for state action and will proceed in a way we think is best for our community. We are seeing throngs of people visiting our beautiful city of Duluth and doing so without wearing a mask or following social distancing guidelines. We love being a city where people want to visit. We need to keep our workers supporting this industry safe. We are doing what we can, where we can, with all that we can, and we will continue to do so to protect the health of our municipal and regional residents. Mayor Larson will be sharing her letter with the councilors and the media at noon today. I want to thank you for the opportunity to share my words and the words of Mayor Larson. Thank you.
Thank you, Councilor Tomanek, and to all the speakers here with us today. An important message certainly to share. And now we will open it up for reporter questions. And it looks like we have our first one from Shay. Shay, there you go. Let's see if we can hear you.
Oh, hi, it's Shay, by the way. And the question is, I put it in the Q&A thing, but the question is, there's rumors going around that there's COVID cases in the St. Louis County Jail. Can Amy Westbrook confirm or deny that information?
Yes, thanks for the question. I have not been able to confirm, I'm not able to confirm that right now. But I can get back to you about that.
Okay, thank you. I have another question, but I can wait until everyone else goes.
That sounds good. We'll come back to you, and maybe now we'll go to Kelly.
Hi, everyone. This question is for the counselors. So do you think that your proposed mask ordinance could further political division that surrounds mask wearing? Why or why not?
Yeah, Kelly, thanks for the question. I think Dr. Pryor said it well, that this should unite folks. The science is really clear on how masks are helpful, and it's not the council's intention to further political division. Unfortunately, I think you see that at other levels of government. This is a fact-based, evidence-based proposal that's intended to keep our community healthy and safe, and hopefully avoid the very real situations you're seeing play out in other states and other cities.
I would just add my words of agreement with that. I think when people really understand that the purpose of wearing a mask is somewhat to protect yourself, but really more to protect others. And it is a simple way that we can do that, to join together as a community, show our support for the people in our community. And it's a simple thing to ask the tourists that come to enjoy the beauty of our city to do for us and for each other.
Thank you. Now we'll go to Chuck Frederick.
Yeah, I have two questions. The first one I think is for our two counselors as well. I'm curious, would an executive order from the mayor be something that could take effect faster? I mean, July 13th is, that's quite a long time. I mean, we're already in midsummer by then.
It's a good question, Chuck. I can't answer whether an executive order could take place sooner or later. The one thing I will note is that we are able to pursue this under an emergency ordinance because of the powers granted by local and state emergency declarations. So it will only take one reading. It will not be our normal 2-reading process, which takes longer, quite frankly. But I also understand folks are feeling urgency around this topic. We also want to be mindful that there is an impact to business establishments that will have to comply. And so it's a balancing act, and it's also a situation that's evolving in real time. And at this moment, I think we feel most comfortable with the July 13th date.
Okay, thank you. If I could ask my second question really quickly, this is for our medical experts, the 3 medical experts. I want to ask about herd immunity, this notion that allowing people who can easily recover, who are likely to recover, to become infected as a way of benefiting the community. Is there any validity to that?
Yeah, this is Andrew Thompson. We don't know, in short. We think that there may be some protection from people who have already been infected to stop that chain of transmission, but we're basing that on studies of other diseases. And there's actually some discouraging information out there about antibodies not lasting very long in people who have had COVID-19. We don't know that they will have immunity for any long length of time. It might be a matter of months. That's preliminary, and we really don't know how it's going to act. Additionally, so far in Minnesota, there's a very low percentage of people who've been infected. So there are still a lot of susceptible people.
To add to that, that it takes, and Andrew, if I'm not mistaken, around 60 to 70% of the population to have COVID-19 to even, and the antibodies to last to get herd immunity, correct?
Correct.
So we're a long ways from 60 to 70%. And to get to 70%, when you look at the percentage of people who die from COVID-19, that is a lot of deaths. We do not want to get to herd immunity. And then even if we did get to that 70% of people infected, as Dr. Thompson said, we don't know that the antibodies last and that you actually have immunity. And in addition to that, there's still another 30% or 40% of the population that doesn't have it. It will continue to spread through the population. And that's what the virus does. So I want to say there's not a healthcare worker probably in the United States or a public health person that would say we need to get to herd immunity. That would be a disaster. Nobody wants to wait for that. The thing to do is to socially distance ourselves, to wash our hands, and most importantly, to wear masks. So I just want to say to the City Council and to Mayor Emily Larson, thank you for taking this step. I can't speak to the business part of it, but I can speak to the medical part. This is definitely the right thing to do. I appreciate you representing the citizens and the tourists coming here. We're really grateful for this. And finally, I'd like to say that we've been looking for an opportunity to play forward the kindness of people from Duluth who gave us masks and made masks for us when we needed them. They'd find them in garages, old ones, N95 masks. They would make masks. As you said, Councilor Tomanek, your friend that made like over 2,000. It was that kindness that really helped us at a time in need. And now we're okay given the numbers of COVID that are out in the community right now. So we want to play it forward. And Dr. Herman's been thinking about this and talking to people at Essentia, and he wants Essentia to donate 20,000 masks to the public in honor of what the City Council is doing. So thank you very much for being so courageous.
That's terrific. We appreciate that, Dr. Pryor.
Thank you, Dr. Pryor. Those 20,000 masks will go a long way to covering people that don't have other access. Thank you so much.
Well, we're in this all together. We're all in the same boat here. So we just have to help each other at these times of needs. And that's what makes me so proud to be here.
Just to follow-up comment to Chuck's question. The age range that we've seen hospitalized in St. Louis County does include people that we would normally think as individuals who would be able to fight off COVID-19 without significant morbidity. And then in Minnesota, we've also seen our age range for hospitalizations as a very broad age range. So we know that a very high percentage of people will be asymptomatic, but we don't really know who. So in theory, that's a good idea, is to build up herd immunity. But we want to do that really slowly, so we're not, and it's hard to do it purposefully. So we want to see as much disease transmission prevented as possible, because we know it's in our communities and we know we're not able to control it. We're trying to manage it. And so managing it to allow our healthcare systems to not be overburdened, so we can have adequate healthcare for people who really need it, who are hospitalized with COVID-19.
We'll go back to Shay.
So this question is for either Counselor Forsman or Tominek. Well, it's a few questions. So it was mentioned that schools are not included in this ordinance. Could you tell us why?
Thanks, Shay. We had collaborations with our school board. We're aware of some likely guidelines that will come out from the governor in the state of Minnesota around K through 12 schools resuming. So it was decided that it made sense to let that process play out, and that's why that's included.
Okay, and also you mentioned fines. I know details are still being ironed out, but do you have an idea of what the cost of these fines will be, and how will you enforce this for individual people? Like I can see it being enforced with businesses if you see a bunch of people in a business not wearing masks, but like how are you going to enforce this ordinance for individual people?
Councilor Tominek, feel free to jump in as well. As far as the fines go, Shay, you're right. We are still developing some details, and we're pretty confident on where that's going, but we are likely to share a lot of those details either later this week or very early next week. So I'll hold off on getting into the weeds on that one. And as far as enforcement goes, this will be enforced just like any other administrative citation that goes through the police department. So if there's a member of the public that is reported, certainly our PD, and we've had conversations within City Hall that we're going to be reasonable. The goal here is not enforcement, but if folks are being unreasonable and there's egregious and multiple violations, there is an escalation in the fine process that can occur, as well as potential trespassing, which businesses will have the option to call 911 as they would for any other behavior that doesn't comply with our laws.
And thank you for the question. I think we'd really like to take a proactive approach. Businesses will be asked to post a sign saying that patrons cannot enter unless they're wearing a mask. Businesses may have the option of offering masks. So we hope that it would never get to that point, that people would see that it's important to comply, and it will just be a simple process.
Thank you.
Thanks, Shay. Kelly.
Hi, yeah, my next question is about the timing of this announcement. So I'm curious why several months into the pandemic now that we're introducing this ordinance where, some cities introduced it right away. I guess I'm curious, was there something in our county's case numbers or something else that caused you to introduce it right now?
Can I actually, I'm not the one introducing it, but let me just say one thing. When the pandemic started mid-March, we didn't know how effective masks were. There's been a rash of studies published in the journals that show that they're very effective. So this is all kind of recent information about how effective they are. So I'll be quiet and let the councilors.
No, we appreciate that, Dr. Pryor. We also have to go back to the fact that we represent our citizens. And quite frankly, we were not being asked by our citizens to take action. And recently that has changed. And I think you're seeing that not only in Duluth, but you're also seeing that across the state of Minnesota with cities like Mankato, Edina, and Rochester all considering action through their councils. So it's a balancing act. We have learned a lot more. And quite frankly, I think community leaders are recognizing we don't want to get to a point where other places are at now. And we have an opportunity to prevent and not deal with the fallout where other cities are not only passing mask ordinances, but they're also shutting back down their businesses. And if we can do one without the other, that would be ideal in my opinion.
I think we can do one or two questions more. Maybe Shay, do you have another question, or is your hand still up from the previous one?
All right, no, I don't have another.
With that, I don't see any other hands up. Let's see, we have one in the chat function maybe. Samantha at the News Tribune writes, if this passes, would it be in effect for the foreseeable future? Maybe the city councilors can talk about that a little bit.
Thanks, Samantha. Yes, so we are tying this to the emergency declarations. This will be temporary. We don't know how temporary, but at some point this will go away when the emergency declarations go away. So none of us obviously can predict when that will happen and how this will play out. But at some point this won't be a requirement in the city, but it will be for the foreseeable future.
I think with that, I don't see any other hands raised or questions being asked. So, unless anybody else here on our panelists or speakers have anything they want to add, I will open the floor for that real quick. Otherwise, with that, sorry, Councilor Tomanek, it looks like you were going to jump in.
I would just like to thank the citizens of Duluth for letting us know their views on this. And they're asking for this ordinance to be passed. They know the importance of keeping each other safe. And as we see the number of tourists that are coming, we want to keep not only our residents safe, but the tourists safe. I again want to thank Councilor Forsman for the opportunity of working with him. He's been a great mentor and really easy to work with. And all the other councilors, the other sponsors on the ordinance, Councilors Kennedy and Councilor Cypress. So we're very, very grateful for this opportunity and for the people on the panel today to help us present it. Thank you.
Yeah, thanks, Councilor Tomanek. She's a quick learner, by the way. She's been on the council for about 3 weeks, and this is a big deal. So we're really lucky to have her. But I just also wanted to add my appreciation for the folks on the panel. And in particular, I want to thank St. Luke's and Essentia for supporting this ordinance. And I know there are a lot of other community partners that are looking at doing that. And so feel free to reach out.
I just want to thank Dr. Andrew Thompson and his colleagues at St. Luke's. St. Luke's and Essentia have really come together and collaborate on this. And I think that we've given very consistent messages, and we've been panel mates here for quite a while now since it started, and it's been great. So thank you, Dr. Thompson.
Thanks, Dr. Pryor. It's been a pleasure.
I think with that, we'll wrap it up. And just a special thanks to the city councilors for joining us today, Dr. Thompson, Dr. Pryor, Amy. I know you guys all have busy schedules, as do the reporters who made time out to attend. So thank you to them as well. If there's anything needed after the fact, please reach out to me and I'll do my best to get some answers. Thanks, everybody.